Dr. Ranjita.
Dr. Ranjita.
Yeah, so a case of 32 years old male with sympathetic ophthalmia.
Good morning everyone. Today I am going to present a case on sympathetic ophthalmitis. So, 32 years old male presented at the IOPD with complaint of the gradual diminution of vision without as watering but associated with the fever, and the diminution of vision was complained by the patient was on the right eye. And the coming to the history of past illness, he had a history of left eye iron hook injury 4 months back, after which the primary repair under the GA and AC was done for the open groove injury. He had no history of hypertension, diabetes, thyroid disease or sickle cell disease. Coming to the general physical examination, the patient was conscious, oriented to time, place and person. There was no pallor, icterus or clubbing. And coming to the systemic examination, his CVS, CNS and chest examination were within normal limit. Coming to the ocular examination, on the right eye, his visual acuity was hand movement positive, and the left eye it was PL absent. And the intraocular pressure was 11 millimeter mercury in the right eye, and left eye couldn't be recorded. And his cornea was clear in the right eye, but due to the complete corneal opacity in the left eye, the other findings like anterior chamber findings, iris, pupil and lens couldn't be assessed in the left eye, but in the right eye it was within normal limit. As we can see in the right eye, the cornea is clear, and pupil is circular and reacting to the light. And in the left eye, as due to the iron hook injury, there was a primary repair, as we can see the sutures present. Coming to the next examination, as you can see in the right eye, the B scan shows a choroidal thickening. And when we did the OCT examination of the right eye, there was subretinal fluid present in the right eye, that is the affected eye. And then we did the fundus examination. There were multifocal choroidal infiltrates present. Then we did a fundus fluorescent angiography in the right eye. As we can see in the venous space, there were multiple leaking foci present. As we can see in the fourth and fifth pictures, there are multiple leaking foci are present. Then we did blood examination, which were within normal limit. Then as we thought of it might be a sympathetic ophthalmitis, so we started the medical management with injection methylprednisolone 500 mg 1 vial IVBD with 1 unit DNS, and injection cefosolvactam 1 gram IVBD, then injection pantoprazole, eye drop difluprednate and eye drop humide. Then, as we can see, after the 4 days of treatment, there is a regression of the symptom. Then, after day 4, we continued the treatment with injection methylprednisolone, cefosolvactam, and pantoprazole, and other eye drops were continued, but injection methylcobalamin was added. Then, as we can see, after the day 10, the subretinal fluid that was present on the day of presentation was regressed massively. Then after day 10, we continued the medication with injection methylprednisolone, injection methylcobalamin, and then we added tab amoxicillin and clavulanic acid, and tab prednisolone 40 milligram 1 tab OD, and then pantoprazole, and other eye drops were continued. So coming to my take-home message, the eyes being small and delicate structures, sometimes even apparently minor trauma can have devastating effects. Though rare, the disease is potentially sight-threatening. Prompt recognition with early institution of steroid therapy helps to salvage the vision. Frequent OCT imaging of both eyes is important. The careful OCT evaluation may expedite the early treatment when indicated. Thank you.
Thank you. the diagnosis is basically based on what? Clinical or the investigation? Which
Both
is the
clinical and
clinically what it was your diagnosis? It was a
sir, as there was a history of
clear-cut diagnosis.
simple
Simple ophthalmitis.
right
What
eye-
else you could think of? Presentation wise.
Yes, sir.
Why you added antibiotic?
So initially we're not sure is
Of
it
what?
is it sympathetic ophthalmitis
Or endophthalmitis?
yes.
नहीं हाँ
Ophthalmitis.
नहीं endophthalmitis. So treatment is only steroid or anything else can be also be tried.
Sir, immunosuppressive can be given.
ठीक है, thank you.